Pulmonary arterial hypertension, or PAH, is an increase in the blood pressure of the pulmonary artery, which brings blood from the right ventricle of the heart to the lungs. PAH is a rare and progressive disease that leads to right heart failure and eventually death. PAH can be associated with all types of connective tissue disease, especially systemic sclerosis. PAH associated with connective tissue disease is the second most common cause of PAH. Systemic sclerosis is the most common type of connective tissue disease that is associated with PAH. With around 75% of patients with systemic sclerosis developing PAH. Patients with systemic sclerosis have an early onset of developing PAH. 55% of systemic sclerosis patients develop PAH within 5 years. Patients with systemic sclerosis who develop PAH mostly carry a worse prognosis. PAH is one of the leading causes of death in systemic sclerosis. Despite the best available therapy, 65% of systemic sclerosis PAH patients will end up dying within 5 years. Early diagnosis of PAH in patients with systemic sclerosis will allow early intervention and treatment, thereby improving survival. An annual screening for PAH should therefore be implemented immediately after diagnosis. Ready to start? Tap here. DETECT is a promising screening tool that will allow every physician to save time and establish a correct and accurate diagnosis. In 2015, the guidelines from European Society of Cardiology and European Respiratory Society recommended the use of echocardiography, TTE, to be followed by annual echocardiography and DLCO. The Sixth World Symposium on Pulmonary Hypertension recommended that any systemic sclerosis patient with uncorrected DLCO below 80% should perform an annual screening using tools such as DETECT tool. DETECT app would help us identify the patients who should be referred immediately to perform a right heart catheterization. DETECT is a non-invasive screening tool that helps in the early diagnosis of PAH in patients with systemic sclerosis. This two-step algorithm-based and risk calculator app stratifies the patients and directs the use of screening tools depending on the overall score after each step. Step 1. The recommendation of performing an echocardiography can be concluded based on lab test results and some questions. If the patient's score recommends an echocardiography, then we proceed to Step 2. All variables are dependent on some scores in Step 1 and the echocardiography result. Once Step 2 is completed, patient will be discharged with a very low risk of developing PAH or will be sent to right heart catheterization. Published studies have shown that DETECT is a very accurate tool for diagnosing PAH associated with systemic sclerosis. In 2018, and after data proved the high sensitivity and very low rate of errors of DETECT, all European societies and the KOL recommended the use of DETECT app even for lower risk cases. Download DETECT app now. Easy and user-friendly tool. Usable in clinic and anywhere. Accessible anytime via your mobile and tablets. Keep immediate record of your patient's score by emailing, saving, or printing it. Benefit from DETECT PAH app to assist in screening your patients with systemic sclerosis and detecting PAH earlier.